Hi, my name is Dr. Scott Desman. I'm an orthopedic surgeon, and today I'd like to talk a little bit about robotic-assisted partial knee replacements. I've been doing these for about 10 years now, and there are certain advantages over total knee replacements by doing a partial knee replacement. Of the patients that require knee replacement surgery, about 20% are eligible to have a partial knee replacement, yet many of those patients who are offered total knee replacement don't even realize that they could be a candidate for a partial knee replacement. So the first thing is to know that this technology is available. The nice thing about this technology is that patients recover much sooner and much quicker than with a full knee replacement, and the knee, because most of the knee is still part of their native anatomy, it feels much more natural to them. So they get better results and recover much quicker. Knee replacement is used when a part of the knee or the entire knee is worn out. A lot of people think that a knee replacement involves removing the entire knee and replacing the entire knee, but it really replaces just the surface of the knee. And a better name for a total knee replacement would have been total knee resurfacing. That being said, if only one part of the knee is damaged, then only one part of the knee really needs to be resurfaced. This is a model of a knee, and if we put the kneecap over to the side and we bend the knee, we see that the parts that rub together are normally smooth. But if they are damaged, they can be replaced by a cap, one on the bottom bone called the tibia, and another one on the top bone, which is called the femur. And with a partial knee replacement, we replace only the one side of the knee that's damaged instead of the entire knee. And if I can show, this would be a partial knee replacement on the top bone, the femoral side, and you can see the size of the implant as opposed to a total knee replacement, which replaces both sides, and you can see the difference in the size of the implants. So this allows us to make a much smaller incision, first of all, in order to implant the smaller device. But more importantly, the other sides of the knee, if they're normal, don't need to be replaced. And this includes not just the bone, but the ligaments. So the anterior cruciate ligament, the posterior cruciate ligament remain intact when you do a partial knee replacement, whereas in a total knee replacement, they're generally removed in order to make room for the implant. By resurfacing the bones, we put these implants in. This would be the tibia for the partial, as again opposed to the total knee replacement, which is a much bigger device and would cover both sides of the knee. The partial knee replacement only replaces one side of the knee. So the knee would function like this, with the rest of the knee being normal and native. The computer and the robot allow us to implant the devices in a very specific and unique way. What we do is we take a CT scan of the knee initially, and it forms a model on a computer, a 3D model. And in surgery, we're able to move the knee, the patient's knee, and watch on the computer the simulated models move in conjunction with real time. We can then, on the computer, implant the materials where we want them to be, move the knee, and make sure that they run together in a proper manner. If there's any way that the knees do not run in a proper manner, we can make adjustments before we make any cuts. Then what we do is we bring the robot in, we make a small incision, and the robot has a little handheld cutting device that allows us to cut the bone. And what it does is it allows us to remove the bone to allow the implant to fit in the space that's created. And the computer only allows us to cut the bone in exactly the space that allows the implant to go in precisely. So it doesn't go in crooked one way or the other way, too far up, too far down, too far to one side. And the same is done for the lower bone. It cuts the bone but allows us to put the implant in so it's perfectly straight. It's not crooked in any of the three spheres of motion. And then the two implants, we can move them together on the patient, and we can watch the computer and make sure that everything tracks exactly properly. And this allows for a perfect result, really, in terms of the way the implant functions in the patient.